Hello, good day, everyone. Thank you so much for joining us today. Today we have a very amazing guest, Kristian Hunt, if I'm not pronouncing your name wrong. And the interesting thing about today's session is that we are going to talk about substance abuse today. And our esteemed guest has a license in clinical licenses, working with a lot of addiction patient as well, and drug and he's in the addiction and drug treatment as well. So we'll talk about how drug
All right, Dr. Collins. Can you hear me? Hello? Hi, Dr. Khan, can you hear me?
Yes, can hear you. If the stream is going down, you can even still talk because the stream is working.
Okay. So, just a little bit about my background, Dr. Khan. So, yes, I am a licensed clinical social worker and also a licensed clinical alcohol drug counselor. What led to me to really pursue more on the addiction side of it was because during my studies, especially when I was in my initial phase of just doing actual clinical work, being a clinician, I noticed that a lot of commonalities were a lot of the clients that I were working with had an underlying co-occurrent diagnosis to where they were using the um, the drug use component,
Yes.
the drug use component of a way to kind of cope with whatever type of mental health symptom that was affecting them at that time. So a lot of the main diagnosis I came across was majority of depression and anxiety. There was a significant amount of trauma as well, and a lot of those type of symptoms are the byproduct of why a lot of these populations were using specifically drug substance use. Um, During the COVID pandemic, it definitely became worse.
Yes,
And
very well said. True.
yes, because if you looked at it, Dr. Khan, especially in America, everything was pretty much closed. But when you look at far as like what was open,
Yeah.
all the liquor stores were open,
Mhm.
and that really played an impact on people were using alcohol and other different types of substances just so they can kind of deal with a lot of these type of mental health symptoms that were
True.
affecting them at the time, like the
Especially
anxiety.
anxiety.
Yes, yes.
Pandemic hit the situation in our in the world, then they get to know that they were suffering from anxiety for so long. But that was their trigger point. Then they get to know the idea that they're actually facing from the anxiety. Okay, I would like to ask you a question. That
Hmm.
as you said that uh, with time you got this passion to work with a lot of patients, because underlying a lot of people who have anxiety and depression and even other kind of mental illnesses, they go for avoidance of
You're frozen right now. K- Dr. Khan, you able to hear me? Yeah, I think we're having a little technical difficulties because you're frozen and I couldn't hear the question. I'm going to write you in the chat. Okay. Yeah, we're still having. You just.
Where's our guest? Jemima zane ba jidar tlai shes jidar tlai. Let me see where our guest is. I'm sure. I'm.
Hi, Dr. Khan, can you hear me? So I guess what I can do is just based off what you indicated in the chat, um, when the best way to really deal with both substance abuse and mental health issues together is that we have to approach it in a concurrent perspective. So first, the best way of looking at it as far as what are the key mental health symptoms that's affecting this person. And then when you look at the mental health portion of it, then you also to assess the cycle of how this addiction is impacting them. So that with the addiction, it pretty much there's a lot of different layers into this. Sometimes a substance use addiction can be a biomedical component to it, where someone can have a family history of it, which now is impacting them as well. That biological predisposition, and and so you got to look at it from a medical aspect of it. Next, you also have to look at it from a psychological aspect of it. So a lot of what you do in the beginning is really based off of the evaluation, a whole biopsychosocial evaluation of it, to really kind of tease out is this is more medical compared to more psychological, or to compare to more societal. So you kind of look at it from that aspect of it. Now, if this if the if the substance use connects more to a situation where someone happens to be impacted based off of a mental more of a mental health diagnosis of it, then we have to look into what are the triggers. All right, what are the triggers? So the key aspects of looking at it as far as the cycle of addiction. Okay, and the cycle of addiction pretty much boils down to these three stages. You have the initial use, you have the abuse, you have the tolerance, you have the dependence, you have
Mm-hmm.
the addiction, and then the relapse. All right, that's the whole stages of addiction. And once when you're able to look at each one of those, all right, and how they build up over time, really gives you a good understanding of how this person deals with their substance use pretty much on a consistent basis.
Okay. Thank you so much for giving us very good response. I also type second question in the chat section as well. You can see the second question over there as well in the private chat actually.
Yeah. So yes, that's a great question. So the withdrawals, it's a really a thin line between a lot of withdrawals and mental health issues, because sometimes a lot of mental health issues can be possibly a withdrawal symptom. So for instance, like I used to work at a outpatient detox facility, and within that role, I noticed that when someone was going through a significant withdrawal, more with alcohol and opiates, their anxiety levels and their depression levels were increasing. So it really is there's a lot of commonalities between the two. However, I would say the withdrawal symptoms has more of a physiological impact. So withdrawal symptoms, you're going to see a lot of more medical components that's really affecting that person. For instance, when you look at alcohol use, you know, a lot of the withdrawals of alcohol use, you're going to see a person who has a difficulties with forming their thoughts. You're going to see that person that has a they struggle a lot with the ability just to focus on pretty much what's in front of them. They're disoriented. You know, sometimes they might have some hallucinations. Sometimes they have the shakes. It's called delirium tremens, where they kind of have the shakes and that aspects of it. So there's a lot of biomedical components to why, with someone who experienced initial withdrawal, which connects to more of a physical component to it.
Okay, so I type another question for you as well. Can you hear me now?
Yes, I can hear you. I know we was having a little technical difficulties, but I'm glad everything is fine now.
Okay. Okay, even then I typed the question in the over there is okay. You talk about the substance abuse, that it is all about, first a lot of people start taking drug as a recreational activity, and you will agree to this aspects as well. Then there's a time came when they start abusing that drug, and then they became dependent to that drug, and then depend when the dependency came, then the body developed that tolerance level. So when you talk about the rehabilitation aspects of these drugs, because over here we are not going to talk about the medical aspect, because there's a lot of medication involved when we talk about rehabilitation aspect, but I would like to ask you about the social aspects of the rehabilitation as well. Before going to the society, that person have to take psychological help from the therapist. So how how you have these individuals who are in the process of rehabilitation? They're not they're at moment they are in the in the facilities, or they're coming to clinic to you. So how you're going to deal these people, and how you help these people out?
Okay. So as far as a therapeutic approach, one thing that is really important to understand is that before I can do any type of like therapy, any type of intervention of them, I have to understand it's called stages of change. I have to understand where this person at when it comes to their readiness of wanting to work towards abstinence. Because sometimes, Dr. Khan, especially in my line of field, when I used to work in an outpatient program, as well as when I used to do outpatient detox, you have a bulk of clients that just come there just to get detox, go home, and continue using again. So it's really based
Yeah,
on
true.
their readiness. So yes, is there a situation where we can just focus on the detox and help them out medically? Yes. Now, if there's someone who really wants to work on their addiction, really work on stopping their drug use, what I do is I assess their stages of change. And there's 5 main stages of change there. You have, it's called the pre-contemplation stage, which is the first stage. Then, which pretty much when that pre-contemplation stage, doc, is that this person pretty much has no awareness that they have a problem. It pretty much, as I indicated, that person who just come in there just to get the help, just to get the detox, just to get the medication. They don't really want to deal with the counselors. They just want to see the nurse and the doctor and just keep it moving. So in
Yeah,
this,
and just take the medication even. They're just seeing the aspect of the medication even.
yeah. So they don't really have any type of interest of wanting to really work on themselves, or really have awareness of the negative consequences of their addiction. You know, and that's going to be this whole cyclical thing of them continuing to use because they don't see any type of issue with it. Next, doc, is called the contemplation stage. So this stage right here is pretty much they have an awareness that there's a problem, but they're really not fully engaged. They're kind of like in this, a key thing here is called ambivalence. They're kind of in this situation to where they know it's a problem, but they're not really yet fully committed yet, but they have an interest into wanting to improve themselves. So right here is a really key stage right here, doc, especially as a therapist, because the whole purpose of this contemplation stage is to get them to the next stage, which is called preparation. So what you do is you kind of assess them, you assess their motivation to see, what are their goals, what are they hoping to accomplish. How I like to approach this stage, doc, is that I used to talk a lot. I used to place a lot of emphasis on what are the negative components of your substance use. What areas has this had a negative impact on your life? I break that down with that client because a lot of times with addiction is everything is so instant. Everything is all about using at that moment, and a lot of it is based on instant gratification. And they don't take the time to really look at how it impacts them long term, or how it impacts the people around them. So I asked them, what are the negative circumstances of how your substance use is affecting you? And then once you talk to that person, you give them that insight, and then they're able to really articulate that. Now you're giving them insight to now move into the next stage, which is called the preparation stage. All right. And this model right here, doc, it's all about planning and working towards just initial short-term goals. All right. Because the thing about it with this whole cycle of addiction, and I noticed that it can be counterproductive with a lot of clients, is that you don't want to place a lot of emphasis on them achieving long-term goals. You want to kind of take it step by step. And a key thing that we use as alcohol drug counselors, and what they do in a lot of the 12 steps recovery meeting is called take it one day at a time. They implement mindfulness in their recovery process. So when it comes to the preparation stage, it's just all about planning of how we can achieve short-term goals just for that person, just to maintain sobriety for a initial duration. For example, I can just work with a person and say, okay, listen, you're in treatment. I'm with you. Let's just work on the first month, the first 30 days, 31 days of not using. Let's just work on that. And what we're going to do is we're going to discuss some goals to help you achieve that. I'm not telling this person that you got to work on this for 6 months, a year, 2 years. No, I'm making it feasible for this person to achieve their sobriety at that time frame. Okay. So next, after when they being successful in that stage, right, the preparation stage, right, what they learning is they learn about themselves. They learn about their triggers. I talk to them a lot about external triggers, all right, people, places, and things. Internal triggers, right, those co-occurrent diagnoses, those co-occurrent symptoms that's impacting that person, all right, and in ways that they can really utilize and kind of alleviate those triggers. And then next, after the preparation stage, then we get into the action stage. Okay. And the action stage is a really important stage because now you have the awareness, you have the game plan. Now we got to put this into action. Okay. So the action stage is really pretty much that. For instance, like if they're done with if let's say they've done detoxing and they're going to see me more long term on an outpatient base. So when they go into certain situations, for instance, like let's go back to alcohol. Let's say like they go to this restaurant, all right, that they used to drink all the time at, right?
Yeah.
The action stage of change, doc, pretty much shows that if that person goes back to that restaurant and if they're sitting amongst other people, they should be able just to sit there, order water, order a non-alcoholic beverage and not be triggered. All right.
That is important thing, basically.
Yeah. So that all in conjunction really shows a degree of resiliency of that person to able to utilize all the material, all of the coping skills, so they won't get triggered at that significant moment. That's called the action stage of change. And then the next stage of change, doc, and this is more long term, it's called the maintenance stage of change. So usually when you see a lot of people who have like years of recovery, like years of abstinence, they're pretty much in this stage where they have now adapted a lifestyle of sobriety. Because beforehand, in those previous stages, like the contemplation, preparation, actions, they're slowly working towards just gaining sobriety. All right. Now, the maintenance stage, which is considered a year plus of recovery, they have now adapted this lifestyle to where everything they do connects with sobriety. They can go to restaurants. They can go past certain type of locations that may have produced a trigger for them, and they're able to be resilient in this process. Okay. But however, doc, the maintenance stage is the most crucial stage because it's really a stage where a person has to really do a lot of self-improvement. They have to always keep up on techniques and ways to really and be creative just so they can maintain long-term sobriety. Because if they don't, all right, then they can be complacent, and that becomes dangerous because when you get complacent, all right, that leads into, oh, I got this. And when you say you got this, you'll start to look up and you might start getting to some old habits. And then that old habits can now lead into the next stage, which is the relapse stage. Now, when you relapse, okay, and a relapse is pretty much self-explanatory. And there's there's a lot of different aspects of how a relapse can be. You have a lapse where it can be a temporary use, and you have a relapse to where you actually can get more into your use based off the amount, the frequency of your actual substance of preference at that time frame. So it's very important to understand that, especially in that maintenance stage, that a person who is really inclined into wanting to achieve long-term sobriety, they have to do things that is conducive to their recovery, such as support meetings. A lot of clients do recovery meetings such as Alcohol Anonymous, Narcotic Anonymous. Sometimes a lot of them do non-12-step meetings. All of those are very important to understand that can help that person to maintain long-term sobriety within their recovery. And sometimes, Doc, what's important to understand is that there's a degree of when a person is going to have to might need some type of form of medication, a medication to really block out cravings or desires for one to use.
I'm really sorry. We have again, issues, a lot of issues over here. I'm sorry to say, we have severe, bad electricity downfall. It's for 2 or 3 hours, and it's a lot of, it's too much hot over here today. And I'm sorry, we have to face this issue. Okay, thank you so much even for being patient. Okay, I like very much the idea that you said that we have to create short-term goals.
Yes.
Like you said, that 1 month goal and 2 month goal. Okay, I would like to ask you one question. And then take therapy, or it's better that you go people come to you as an outpatient, which perspective is better, like staying in some place, taking the rehabilitation perspective and withdrawal perspective as well? Because for substance abuse, if you talk about rehabilitation, then medication is involved in that aspect. So it's better for those individuals to be inpatient in some setup and take therapy from you, or come to you as an outpatient. What do you suggest? What is the better way?
It's a good question. It depends, Doc, on the severity of their use. That's how you look at it, like the severity of their use, and how because a lot of times some people can work well in outpatient setting when it comes to their use. All right, some people can't, and what's the distinction between the doc is looking at their environment, how the environment is. If they living with someone who's constantly using, is their environment gives them access to use. If their environment and their social setting is a significant trigger to them, inpatient would be more appropriate for that person. And then even with inpatient, after they get out, the good thing about it is that there's access to people so they can able to get into a location such as a sober living facility to where they're able to live there to get better resiliency when it comes to their substance use. So it really boils down, Doc, to the difference between inpatient and outpatient. Is there the environmental factors of it, if there's significant environmental stressors? And then also it goes back to, as we discussed earlier today, as far as their readiness into treatment. That really boils down to the most important one, their readiness, how they're able to really work towards, and their motivation to maintain sobriety.
Work on the rehabilitation perspective as well. So, or I always have one question in my mind when I look at substance abuse and drug addiction cases. That whenever they get detox and they're like taking therapy from you as well, the important aspect is their social life is revolving around those people who are using drugs a lot of time, because they have the same friends. Like you said earlier, that if they are going to some restaurant where they used to do a lot of drinking, or using some drugs over there, so they're is that how a person is going to change a new life, because whenever you talk about these people who are using drug, they have a history, they have friendships like that who are using, and they're living in the community. So how you are going to work on that aspect? Because you, like you said, you're a social worker, so how you're covering these aspects of the individual who are using drugs?
Yeah, that is a key, and to me that is a really very important component to why a lot of people relapse, because a lot of times they do not change their circumstances. They do not change their circumstances. A lot of clients think they're able to, if they stop using, they think they're able to, like you said, or they think they're able to manage hanging out with previous people, past people, and think it's going to be okay. It's going to put them at a high risk, to be honest with you. And sometimes, um, a person really has to understand that, So it goes back to their readiness again, as far as now, this is, remember, Doc, when it comes to that stage of change, that maintenance stage, right? You have now incorporated a lifestyle sobriety. So when you incorporate a lifestyle sobriety, anything that you change, even in general in life, anything that you're trying to change in general requires some type of discipline and sacrifices that needs to be implemented. So one key thing that can be an aspect of it is, removing yourself and distancing yourself from people who are actively using. It usually boils down to that. So there's times that I work with people who told me, and then we worked on some goals as far as like, listen, I used to have this using buddy. I used to have family members I used to use with. Now that I'm sober, I feel better. I'm in a good spot now. Now I have to remove myself from this person, or I have to distance myself from this person. Sometimes, Doc, there's situations where people are unable to do that because sometimes they might live with someone who's actively using, or I have,
Yeah,
like, a
true.
close family member
It's actually coming
who's
in my
active.
mind as well. Yes, true. It
So
was coming
so
in my
then
mind that if you said that if a family member is using that thing, then how you're going to fight this thing?
yeah, yeah. So a lot of times what I do is I work with that person on how to set boundaries. All right, how to set boundaries with that individual, as far as like, always, indicating that you're in recovery, and this is a very significant type point in your life, and this is what you're going to work on. And another thing, Doc, I tell a lot of clients is that, listen, this is a really good indication of your relationship with this person, because if this person's really a true friend, a true family member who has your best interests, they should be able to respect and acknowledge that you stop using, all right, and able to be supportive in that, in this situation. If the person is starting to, um you know be in a situation to where they're like, yeah, yeah, nah, don't worry about that, let's just, I have whatever, I have this packet, I have these bags, I have this bottle, whatever the case may be, like, you could get a little bit, a little bit's not going to hurt. You can do it in moderation. All right, that's a deadly term right there, in moderation. That person doesn't have the best interest for you. All right, so this is a that is a really good experience for that person to really make a really important decision as far as where you stand amongst a relationship with a person who is either supportive to your recovery or can enable you to relapse. Doc, can you write in the chat, Doc? Can you repeat that one more time, and can you put in the chat, Doc, the question? Because you're frozen. Um, So before I answer that question, Doc, I do want to talk to you about something that's very important about the significance of family support. I'm gonna get back to your question. Family support is very important during this process of recovery because sometimes a lot of clients feel as though like they're alone in this process, especially amongst um, you know just the difficulties in the transition of really achieving sobriety. So family support is really important here. And when I mean by family support, it doesn't necessarily mean actually a blood relative. Family support can just be anyone who you able to trust, a person who you consider to have a really strong kinship with, and who is a really significant component to your recovery. So it can be friends, it can be people who you can connect with at work, and it can be individuals who a lot of times, as I stated beforehand, a lot of people do recovery meetings, um, Alcohol Anonymous, Narcotic Anonymous, Smart Recovery, non-12 steps, support meetings. Those individuals can be part of your family support system because when you have multiple people that have your best interest for you, that right there gives you a sense of accountability and collaboration to motivate you to really want to do better, right? If you have that degree of community with everyone that's there to have your best interests, that want you to do better, it's going to push you to a point where you you are going to look into ways to really extend your sobriety. You're going to look into ways of how you can really gain more skills with maintaining your recovery. You're going to be able to get feedback from other people who has many a longer duration than you, that help them to maintain long-term sobriety, and you can utilize those skills within yourself. So it's very important to really have a good community-based system amongst other individuals that has your best interests while you're achieving sobriety, and especially if the goal is long-term sobriety. Doc, you're still frozen. Can you write it in the chat again? Yeah, we're having a little.
I think we are back now. So can you hear me now?
Yes, I can hear you. You had a moment where you're just frozen.
Yeah. Okay. So I just asked you a question about the teenagers and risk-taking behavior, because at that age, a lot of children are making, doing this in recreational activity. So I would like you to, how you are going to advise those individuals, those teenagers, to not take these drugs, because uh, a lot of people are asking this question from me, that there are a lot of people in the society who are using drugs, but they're not dependent to.
Okay. Yeah. So okay. So as far as with relapse prevention within the adolescent stage, it's that is a very difficult stage because one key thing about the adolescent stage is that is there's a very high degree of acceptance. Like teenagers are in a stage of life where they're trying to find themselves, and in the midst of finding themselves, they have a tendency to want to be included in things that they deem to be like popular per se. And usually what was usually popular, especially when I was in high school, it was usually the areas that was very negative. So the best way of really preventing substance use among adolescents is to really focus on a lot of the negative circumstances of it, and a lot of negative circumstances of it is pretty much the withdrawal potentials, how this can have a negative impact on your life. If they're using substances that's illegal, you can place a lot of emphasis on the legality of it and how this can not only just have an impact on you physically, but also legally, especially if there's any type of like um, criminal activity among you using, if there's law enforcement that finds out you have this in your possessions. Um, and I remember when I was in school, they had this drug program called Dare, where they used to have law enforcement used to come in. They used to bring a lot of people who were um, who used to be um, individuals who will use substances, who are in recovery, and kind of talk about a lot of the negative circumstances of use. So it's pretty much really boiled down to psychoeducation in this age group. Some of them get it, sometimes some of them don't. And unfortunately, sometimes when they don't, it's usually a situation where they have to learn from it from their own experiences. And one key thing that as a counselor and as I talk to a lot of people about is that if you're going through experience like this, especially substance use, God forbid, we don't want to make sure anything is fatal. And sometimes people have to hit a rock bottom in order for them to be accountable into maintaining and achieving sobriety. So just to answer your question, really consists of a combination of different type of psychoeducation, educational approaches to help the teenagers to prevent substance use. Yeah, Doc, you're frozen again. Are you able to hear me? Um, I pretty much would like to. I pretty much would like to say that that just going forward, that if a person wants to really focus on long term sobriety, is that they just have to make sure that they have that they.
Can you hear me now?
Yeah, I can hear you now. So just to conclude what you just said, Doc, pretty much what's a good tips for a person to do to maintain long term sobriety is making sure that they have that insight, they have awareness of their triggers. All right, those external and those internal triggers. Once when they understand how their those triggers works, and sometimes a lot of those triggers are buildups. So they understand how those triggers works, and then what they do is that they apply those coping skills. And their coping skills is pretty much things that they can do on a daily basis. It can be a list of self-care activities. It can be a list sometimes of medications. It could be, your community that you surround yourself with, that support system. And you continue to maintain that, and always understand that you're in recovery. All right. The moment that you say to yourself that I got this. I can do this in moderation. Those are very deadly terms to do, because then you'll start to rationalize that you're able to do this in moderation. You look up, then you back to using again. So really always remembering that you're in recovery. This is an ongoing thing, and to always utilize those coping skills and be mindful of your triggers. Okay. All right, Doc, it was a pleasure talking to you. We'll definitely talk offline more. I definitely would like to do this again. I know we had a lot of bad connections, so maybe we can talk about in the future about doing this again, because I think this is a very important discussion for everyone to hear globally. So it was great talking to you, and we'll definitely talk more. I hope it was a pleasure, and I wish you the best in your career, and we'll definitely discuss more in depth. Have a good day.